from Florida.
Thank you very much, Madam Speaker. I yield myself such time as I may consume.
And the gentleman is recognized.
Thank you, Madam Speaker. I rise in opposition to H.R. 5, and this bill overlooks the rights of injured patients. But it's also an attempt by the House Republican leadership to dismantle the Affordable Care Act. I would remind my friend from Florida that there is no example that allows for any of us to have it both ways. This matter violates the Constitution, and clearly not just those who argue the 10th Amendment from a conservative or liberal perspective. It is all of us that feel very strongly that this measure usurps the powers of states. I'm fond of saying what Randy Barnett, a Constitution law professor at Georgetown, said, that people seem to be fair weather federalists, and they abandon federalism whenever it is inconvenient to someone's policy preferences. H.R. 5 combines two completely unrelated measures. The first one is the reform of our nation's medical malpractice system. The second one is the repeal of the Independent Payment Advisory Board, which was established by the Affordable Care Act. Please don't get me wrong. I'm fully aware of the challenges inherent to our medical liability system. The excessive cost of malpractice insurance faced by physicians seriously impairs our nation's healthcare system by encouraging the practice of defensive medicine. This contributes to higher healthcare costs for both doctors and patients, as well as diminished access to care for consumers. But while I agree that our medical liability system needs to be changed, I do not believe that it should be at the expense of the fundamental rights of patients, including their ability to seek compensation for wrongful injuries. Indeed, this bill imposes an arbitrary and unfair cap on non-economic damages that injured patients can receive. Such limitations will extinguish our rights and have a devastating consequence for individuals harmed by physicians and medical products. In addition, this bill seriously encroaches on the 10th Amendment of the Constitution by preempting state laws. And I'm not buying the confusion offered in the Rules Committee on yesterday, nor by my good friend from Florida. I know preemption when I see it. I know the 10th Amendment, and I know that people have stood for the 10th Amendment, and I need not remind my colleague that countless Republicans have made statements regarding this particular matter not fitting within the framework of the 10th Amendment's commerce provisions. My Republican colleagues like to talk about frivolous lawsuits and unreasonably large jury awards. But I asked the question yesterday of the maker of this particular provision, what is his leg worth? It's easy for us here inside the Beltway, and it's easy for us on the Republican or Democratic side, liberal or conservative, to be about the business of talking about somebody's harm. And then what happens is all of the lawyers that are the bad people of the world, everybody wants the best lawyer when it is them and their problem that is the problem. And I asked the maker of the bill, how much is his leg worth? When you cut off the wrong leg, who can stand among us and say that $250,000 is enough? So where did that cap come from? It came from a 1978 provision, $250,000. This is 2011, moving fast with costs rising. I ask anybody here or that is within the range of measure at this time, please tell me when your health care insurance went down. I don't know of any example. I've been paying health care insurance for 49 years, and it's gone up repeatedly during that period of time, and I don't care whether there was a Republican president or a Democratic president. Health care costs went up, and I don't think that this little measure here is going to bring it down. What do you think about the family in Chicago whose perfectly healthy baby was born lifeless because the hospital team failed to provide him with proper oxygenation during labor and to perform an emergency cesarean operation on the mother? The boy is now 5 years old, suffers from permanent neurological damage, and is totally dependent on the care of his parents for all his daily activities. You ask his parents if $250,000 is enough for a lifetime of care. Oh, no, then you say, well, thrust it on the states. Let Medicaid take care of it. And then what you do under the Ryan budget, my good friend, is you say block grant Medicaid. And I saw that movie in Florida when they block granted Medicaid, and it was used for everything else other than for poor people. Something is wrong with that movie. What about the judge in Palm Beach County who had a surgical sponge left in his stomach after having abdominal surgery and had to wait 5 months to have it removed? By then, the pus and bile stain mass measured more than a foot long and a foot wide, and the rotted part of his intestine had to be removed. Ask him if a lawsuit was frivolous. Each case, each injury is different. It is not the role of Congress to decide the fate of these individuals and families devastated by malpractice by establishing arbitrary limits on the financial compensation that they're entitled to. As you all know, the medical malpractice portion of this bill is actually a pay-for, meant to offset the repeal of the Independent Payment Advisory Board. IPAB, or IPAB as it's referred to around here, is a board of 15 physicians and experts established by the Affordable Health Care Act to find ways to control health care costs associated with Medicare. Under the Act, IPAB will make recommendations to slow the growth rate in Medicare spending if spending exceeds a certain target rate. The Congressional Budget Office estimates that the repeal of IPAB would increase direct spending by $3.1 billion over 10 years. $3.1 billion. Now is not the time to repeal measures that can save our nation money and reduce our deficit without offering any substitute, and that's the takeaway from this. My friends say, don't do IPAB, and I say to my friends, what do? And you do nothing. That's what you do, and that's what you've been doing here in the Congress since we came here. We have given do nothing Congress a new meaning. Rather than dealing with jobs, the things that people are completely interested in, rather than passing the infrastructure measure that the Senate has passed that will deal immediately with jobs in America, we're around here passing a measure, and it will pass the floor of the House of Representatives, that will go to the Senate and go nowhere. So then what did we do? We did nothing. The Congressional Budget Office also estimates that thanks to the cost-saving mechanisms in place in the Affordable Care Act, IPAB will not likely be required to act for the next 10 years. I heard my colleague just a minute ago say that health care costs have gone up since President Obama has been in office. My mom is fond of saying that if we're going to keep pointing back to the other president, if we say now Obama says Bush did it, and Bush says that Clinton did it, and then Clinton said that Bush did it, and Bush said that Nixon did it, and Nixon said that Carter did it, then we could just point back to George Washington and say George Washington did it then and get it all over with, rather than continuing this charade before the people thinking that somehow or another we have the solution here. Healthcare costs have gone up, and they're going to continue to go up until we, as men and women in the House of Representatives and the United States Senate and the American people, sit down and decide that this is a solvable for us to address those things that are vital in this country. The bill is a complete waste of time. It does nothing in addition to going nowhere. It does nothing to help the American people. It contains nothing to improve the affordable and accessibility of health care. And repealing IPAB, you want to talk about frivolous? That's what frivolous is. Let us give the American people what they really need right now, and that's jobs. How many times do we have to say that down here for people to finally get it? Frankly, I'm appalled by the hypocrisy of my Republican colleagues who keep stating that federal spending needs are to be kept under control. But at the first opportunity, they wind up rejecting one of the most serious tools in place to actually tackle Medicare spending and find ways to make care more affordable. What are the Republicans offering to replace IPAB? Nothing. Since the beginning of the 112th Congress, the Republican majority has sought to repeal as many provisions of the Affordable Care Act as possible without providing any replacement. Listen to that, without providing any replacement and absolutely no long-term solution. If we do nothing, Medicare costs will continue to increase, thereby increasing the burden on millions of seniors, disabled individuals, and their families all across this country. What is the Republican plan? What is the plan? It is to replace Medicare with the new Ryan budget introduced on yesterday, replace it with some kind of premium something that ain't nothing but a voucher system that would certainly result in increased costs for seniors and reduced benefits. The truth is that the Republicans have no plan to reduce Medicare, and I defy them to present it. If you look at the budget that was released yesterday, it's all filled with blank spaces, and I'll fill in the line, nothing, nothing, nothing. So instead of just repealing IPAB, let us improve it, reform it, or replace it. By doing nothing, it's surely not going to fix the problem. I reserve the balance of my time.